Hello friends, welcome back to allornonelaw. This is a medical video lecture, Microbiology, and the subtopic is Immunology. And today's topic of discussion is defects defects of phagocytic cells. So guys, this is a really very important topic for Usmle step 1 and for medical students. So let's start a discussion on this. So you know what a phagocytosis is. A phagocytosis is nothing but eating up of intracellular microorganisms. So for example, if this is endothelium, okay, and this is what you call a phagocyte, okay, right, and this gets attached over here, then it forms a space, then it gets attached. These are the process in the phagocytosis. I will try to describe what you call about the processes of phagocytosis. So remember, in this video I'm going to talk about what happens when there is a defect in phagocytosis or phagocytic cells. So there are what you call 5 important diseases that you should know for your USMLE step 1 examination. And guys, this video is going to be helpful for your USMLE step 2 CK. Okay guys, so let's start a discussion on this. So let me start with the important diseases. That is, the first one, I will try to talk about the CGD. I'm going to talk briefly, okay? So remember, the chronic granulomatous disease, you know, it's an X-linked recessive disorder, right? In which there's a deficiency of enzyme known as NADPH oxidase. Okay, so this, when there is a deficiency of NADPH oxidase, the oxygen is not converted to oxygen radical, superoxide radical, and hydrogen peroxide. That's why the hydrogen peroxide acts as an antibiotic, and this is also acts as an antibiotic. So this conversion is done by the NADPH oxidase. In a patient with CGD, the NADPH oxidase is lacking, so no oxygen is converted, and OH or H2O2, hydrogen peroxide and hydroxide radical, are not formed. So the bacteria, intracellular organism, is not killed. So they will have the what you call infection. Okay, right. There's another one interesting thing. In these patients suffering from a CGD, they will only have catalase positive infection. The catalase positive organism, like staph family, like Staph aureus, Staph epidermidis, Staph saprophyticus, right? Then we have fungi like Aspergillus, okay, Klebsiella, Serratia, okay. These are the important catalase positive organisms. So the patient, if in USMLE, if they gave that, the patient is repeatedly infected with the what you call catalase positive organism, think of CGD as the right answer. You might be asking why there is no CGD, what you call a catalase negative infection in these patients. Guys, because the catalase negative organism, the cat negative organisms like strep, right, what they do, they produce the H2O2. Okay, they produce the H2O2, and this H2O2, you know very well, that's a what do you call it, it acts as a microbicidal and kills the organism. And along with this, it reacts with the chlorine in the presence of enzyme known as meloperoxidase. In a previous video I discussed in detail regarding CGD. So meloperoxidase, and forms a hypochlorite, and that hypochlorite is very dangerous and kills the what you call intracellular organism. That's it. That's why these patients will have catalase positive infection repeatedly. Got it guys? Good. Now let's move on to the what you call next disease. That is LAD. That's nothing but leukocyte adhesion deficiency. Let me write here. Leukocyte adhesion deficiency. Okay, the LAD. What happens in LAD, remember, it's a autosomal recessive disorder. It's an autosomal recessive disorder, AR, okay, in which there is an absence of CD18, which is a common beta 2, okay, beta 2 chain of a number of integrin molecules. In general, to brief you with, the function of beta 2 chain integrins is that they helps in the attachment of phagocytes to the infected area. For example, if you want to attach, this is the epithelium, okay, or endothelium, sorry. You have phagocytes right here, right, phagocyte, right. When it wants to get attached to a specific point where the infection is taking place, we need the attachment bonds that is known as integrins. These are the functions of integrins. They help in the attachment of what you call a phagocytic cell to the infection area, right, to kill the organism. When these integrins are lacking because of the CD18 lacking in LAD, leukocyte adhesion deficiency, the phagocytes are not able to get attached over here. Thus what happens, they will have increased number of granulocytes, phagocytes in the blood, but no pus, no abscess, okay. So remember, this is a really very important point you should know. Why there is a no pus or no abscess in LAD? It's because of the lack of CD18, which is nothing but what you call is a common beta 2 chain of integrin molecules. What does the integrins do? Integrins helps in the attachment of phagocytes to the endothelium, right? When there is no attachment, then what happens? They keep on rolling, and there is no pus or no abscess. Got it, guys? So these patients will have repeated infection, bacterial infection especially, okay. Remember, this is really very important. The first indication of this disease, defect in a neonate, you see omphalitis, okay, is swelling and reddening around the stalk of the umbilical cord, remember, okay. So that's why this is a really very important. How would you diagnose that? The one method of diagnosing LAD is nothing but finding beta chain CD18 of the integrins by flow cytometry. What happens in Usmle, how they will trick you is they give the history of what you call no pus or no abscess or umbilical cord swelling, omphalitis, and they ask you that which of the following methods or a technique you can diagnose this disease. So remember, it's a flow cytometry, okay guys. So how would you treat it? It's simple, give the antibiotics repeatedly, and if you want to treat it permanently, because this can reoccur, so you can do what you call a bone marrow transplant or bone marrow donor you can think of, okay guys. So these are the things that you should think of, and this is the second disease we discussed over here. And let's talk about the least important diseases for USMLE. One, we have Shedike, Higashi syndrome, okay, where there's a granular structural defect, okay. What's the importance in this is just for USMLE, try to look for what's called a partial albinism, okay, right. So recurrent infection with the bacteria, chemotypic and degranulation defects, you know very well. So there's the absence of what you call natural killer cells activity, NK cells activity, okay, right. And the albinism is really very important, you should look for. If you want to diagnose with a Shedike-Higashi syndrome in USMLE, try to look for partial albinism, really very important, okay guys. So let's move on to the next. We have, if what happens if there is a deficiency of meloperoxidase enzyme. So this meloperoxidase, what it does, the H2O2 produced by the conversion by NADPH, okay, what happens, it combines with a chloride to form a hypochlorite, HCl level, right, hypochlorite, okay, hypochlorite, and that hypochlorite is really microbicidal and kills the organism. So we know very well, to kill an organism we need three things through oxygen dependent mechanism. One, hydroxyl radical, superoxide radical. Second, we need H2O2, hydrogen peroxide, and third we need hydrogen, what you call hypochlorite. So here peroxidase helps in the formation of hypochlorite, right? So if there is a deficiency of meloperoxidase, the hypochlorite is not formed. But guys, there are other mechanisms to kill the intracellular organism. That is the H2O2 is there, hydroxyl is there, and oxygen independent mechanisms are also there. That's why these patients suffering from meloperoxidase will have very mild disease. Okay, mild, very mild. Remember, okay? Got it? Right, excellent. Now the other one is, the fifth one we have is what you call G6PD deficiency, which I will discuss later, and that's also really very important. And there is a deficiency of essential enzyme in what you call HMP, that's a hexose monophosphate shunt. Okay, and in this patient, remember, they will give the history of anemia. Okay, anemia is really very important. That can help you to differentiate from other disorders of defects of phagocytic cells. Okay guys, so I hope you enjoyed watching this video, and thank you so much for watching this video, and please do share our videos with your friends. Please do subscribe, and please tell your friends to subscribe, and please repeatedly watch the videos. Thank you so much for watching this video. Take care.